Before we jump into today's episode, I'm so excited to be able to tell you that my debut book, Optimal You, Supercharge Your Energy, Strengthen Your Immunity, will be published on the 19th of November, with the Kindle edition available on the 18th for 99p for one day only, so set an alert in your diary. Optimal You is a groundbreaking guide uncovering the 8 pillars of health for supercharged energy and strengthened immunity to optimize your health and extend your health span. Delve into evidence-based strategies to optimize nutrition, balance your lifestyle, reduce toxin exposure, and address root causes of health imbalances. There's a 14-step anti-inflammatory nutrition blueprint included in the book to supercharge your mitochondria and fortify your immune system. Plus, my 4 lifestyle S's, sleep, stress, strength, and social, that form the foundation of optimal well-being. The book will help you to empower yourself with practical tools and insights to embark on a transformative journey towards the optimal version of you. You can pre-order your copy or read what people are saying about the book at optimalyoubook.com. Now let's head to today's episode. Welcome to the Good Health Podcast. I'm your host, Nicole Good, a certified functional medicine practitioner, registered nutritionist, and author. In this podcast, we delve into the world of energy and immune health and wellness with positivity, from optimal health and energy to stress and burnout, right through to immune conditions such as thyroid and autoimmune disease. We deep dive into functional medicine, nutritional medicine, and lifestyle medicine, as well as the personal stories of our amazing guests, from Olympians to famous faces and guest experts from all different parts of the health and wellness world. It's time to stop letting your health hold you back and become the optimal version of you. Don't forget to come and join the conversation on Instagram at good_health, that's GOODE, or visit the website nicolegoodhealth.com to find out more. As promised, we're back with another episode with guest Dr. Maggie Yu. So if you haven't already listened, we had Dr. Maggie on for episode 44. Dr. Maggie Yu is a medical MD. She's a certified functional medicine physician. She's also a mother, a teacher, a speaker, and a thought leader. And over the past 16 years, she's been helping and educating people all around reversing chronic diseases. Dr. Maggie is a visionary in the field of functional medicine, and her transformative approach combines the best of medical knowledge with holistic care. In episode 44, Dr. Maggie joined me as we talked about some of the problems with conventional medicine and why her being able to combine functional medicine really gave that holistic approach to uncovering the root causes and managing conditions like Hashimoto's and POTS. We looked at the importance of diet, lifestyle changes, and also self-advocacy in health management. As promised, today we're going to discuss histamine, which was something that we touched on in episode 44, and we just didn't quite get round to it in the conversation. So Dr. Maggie very kindly agreed to come back on the podcast so that we can explore this for you today. With that, let's jump straight into the conversation. And if you haven't already, jump back and have a listen to the previous episode with Maggie. Okay, so Maggie, welcome back to the Good Health Podcast. It's great to have you here again. We had such fun last time, and I know we got to kind of the end of the episode and we picked up on the fact that we hadn't even got to talking about histamine and MCAS, which we'd sort of said we would do. So it's great to have you back here today, and we can dive into that as a topic today as well, which will flow on nicely from the last episode. If people want to find that episode, we were talking about POTS and autoimmune. So this flows in nicely with all of that. That's what we're going to deep dive into today. And it's great to have you here.
Thank you for having me here. And before we even hit record, one of the things that I don't think that people in the public realize just how big of a problem MCAS, Mast Cell Activation Syndrome, and histamine intolerance is, whether or not you have a diagnosis. Because I asked you the question, what percentage do you think of your functional medicine practice has patients with symptoms relating to mast cell or histamine intolerance? And you said...
I estimate it's around 40%.
And I said, me too.
Yeah.
And that's the thing is out there, most people in the public have never heard of the term, don't even know what we're talking about. And yet it is filling up at near half of functional medicine practices. So this is a huge problem.
And it commonly as well, I'm finding it's not necessarily like the sole issue. So they've often got other diagnoses. So they don't necessarily pick up on histamine or MCAS, but have picked up on their other diagnoses, for example, and they come to you with those. But then as you start working on the case, you find the histamine and MCAS that they didn't even really know they had. I find that probably out of the 40%, I would say that's, for most of them, that's the way it comes to me. Very rarely does somebody actually come to me and say, I need support with histamine or MCAS. It's usually that we find it as they've come with something else.
Well, what I find is the term that we choose to label it in itself can be isolating, alienating, and also misleading. So what I find is that right now, the audience is probably half of them are wondering, what are they talking about? So when you're talking about Mast Cell Activation Syndrome and Histamine Intolerance, it's basically really heightened allergic responses anywhere throughout your body, escalating over time to the point where something's really different, something's really wrong, nothing seems to help. If we utilize that definition for it, everybody understands and everybody knows somebody with it. If you say mast cell MCAS or histamine intolerance, people are like, I don't know what they're talking about. And that includes doctors. Doctors don't know, half the doctors don't know what we just said.
Yeah.
The term. But doctors who are trained to recognize it, like Nicole, you, and I, we say, oh my gosh, it's 50% of our practice or 40% of our practice. It's because we recognize we are constantly working with people who have heightened allergic reactions that seems to come out of nowhere, or there's a long history of it, but suddenly the rate that it's getting worse is a lot faster. So then people come see us because they're getting no help in the traditional medical system because those doctors have very limited tools and there's limited number of specialists, quote unquote, that deal with allergies. And they don't really understand mast cell or histamine intolerance. There's really very little they can offer to people.
Yeah, I actually had one patient recently who came to me and we discussed histamine issues, and she went off to see her GP, her general practitioner, family doctor, and this is what we think it is. And they were just like, well, that's like not a thing. That's what she was told.
Yeah.
It's not a thing. That's not what the problem is. It's not a diagnosis. She said the reaction was almost, that doesn't exist. It's not a known thing. But I mean, if you you can Google anything and stuff will come up. But if you put this into research papers, there are research papers, there are studies on MCAS, so many of them. That was the first time I've ever really had someone turn around and say doesn't exist to a patient. But it really isn't commonly recognized, is it, at all? Even in, medical world and even in functional medicine, I think there's still some cases where it's not necessarily getting picked up.
Well, I think what we can't name, we don't know what to do with.
Yeah.
There's a lot of power in naming something. And as doctors, regular doctors, I was a family medicine doctor. I'm still a family medicine doctor and a functional medicine doctor. Our job is to name it. And really also name things that there's something we can do something about quickly.
And name them when they get to the point, and this was something I was actually talking about on another podcast episode that I've recorded. It's not gone out yet, but it will have done by time this one goes out. And I was talking about how naming it, but once it reaches the point of fitting in the box of diagnosis, which means that naming it once you've got damage to organ or tissue, because that's really what a lot of the diagnoses are, the conventional sort of diagnosis. A lot of them are when there's actually already damage, but we can jump in so much earlier with things. We don't need to necessarily fit into the box to get support.
Well, I love that what you just said there, because for me, I'm thinking about cancer as a diagnosis. And the only reason really to diagnose it, get the subtype and all that is to define what treatment modalities are going to be for it, right? So, and all the treatment modalities is either chemotherapy, radiation, which is big business, okay? And so for me, I tell people all the time, there are way early decades, even childhood signs that someone's at higher risk for cancer, really high probability. I think about thyroid, for example, people with Hashimoto's. People with any autoimmune disorder of the thyroid is 10 times higher risk of thyroid cancer. Not 10%, 10 times higher. But yet, we don't sit here and as doctors name that these autoimmune thyroid conditions are basically at super high risk of cancer. We don't name any problem with their thyroid until they get cancer. And we'll even do an ultrasound of thyroid and say, there's kind of these nodules, they look okay. Let's retest it in 1 year or 3 years or 5 years. And what that technique is waiting for is, let's wait till there's enough end organ damage and change to that organ. So then I can say, aha, now I know what that really is. And excuse me, I'm a fan of the cursing words. I'm going to say, no shit, right? But what's harder and more effective is, why don't we catch it 5, 10, 20 years earlier and do something to decrease or protect that thyroid so we never get that diagnosis? Doesn't seem as sexy, does it? But it's way more effective. And we're not doing that here with cancer. We're not doing that with autoimmune disease. And we're certainly not doing that for people with mast cell activation syndrome, because they have signs and symptoms years, sometimes decades before, but nothing is being done until they get to this really heightened point where there's severe impairment in people's lives. And then we sit here, and because doctors aren't trained in it, they even tell those people, well, since there's nothing we can do about it, it's not real.
And it's also not profitable, right?
What money is there in preventing cancer? All the money in cancer is for chemotherapy. One cancer patient is worth millions of dollars of chemotherapy per year. So all the research going into cancer is chemotherapy and radiation and surgeries that bring in hospitals and healthcare systems millions of dollars per person with cancer. So cancer is big business. If we cured cancer today and there's no cancer, most of the healthcare systems that you see today will go bankrupt.
Yeah. I can't remember where the quote came from, but someone said it isn't healthcare, it's sick care, because it is keeping you sick is actually more profitable to them than keeping you healthy.
Right.
And I know, and I mean, that is the extreme, but there is a truth in the message of what the person was trying to say, you know, around the sort of the profits and things. And it isn't profitable to find things like you said, like MCAS and histamine intolerances, and finding them early. Even autoimmunity, there isn't profit in finding it early and helping it from a preventative point of view.
Well, who makes money actually off of treating autoimmunity? Who makes money off of people with autoimmune disease getting better? Think about one person that would get rich off of people being diagnosed with mast cell and being able to treat it. Very few profit incentives for people to diagnose or fix or cure mast cell. And it takes a lot of work. And that's what we're talking about today, is what can be done to fix it. It's not a one-pill solution. And the moment there is going to be a one-pill solution and somebody's going to make a lot of money off that one pill, you'll hear about mast cell everywhere. You will, I promise you.
But right now, that's just not the profitable answer. And I think it gets, when we can't put things in a box, and actually, you know, like we said last time you were on the podcast, we were talking about POTS, and I think the same thing happens with POTS that happens with MCAS, in the sense that it gets dismissed as not existing. And I think a lot of that comes from, it doesn't necessarily always fit into a box. It isn't easy to sort of put people into a box. If you find it earlier on, there might be some signs and things like that. We're too focused on putting people into a box and getting diagnoses. I always say to my patients, I'm not over interested what your diagnosis is. You don't have to have a diagnosis to come and see me. It's good to know, but I don't need to know.
Yeah. Let me tell you, right now, I just wrote down, what are 4 signs of someone with mast cell or histamine intolerance that appears decades before? Take notes if you're listening, right? So these are 4, and none of your doctors are going to tell you this. And this has only happened because I've worked with thousands of people with mast cell histamine intolerance. So number 1, there's certain hormonal patterns that are telltale signs that someone's at higher risk of increasing allergic reactions later in life. Number 1 pattern on that is called polycystic ovarian syndrome, PCOS. Okay. I can go into that forever, but I'm just going to make a list right now. So 1, if you or your daughter or someone in your family has PCOS, polycystic ovarian syndrome, your chance of getting increasing allergic reactions over your lifetime goes up like tenfold. That's my experience, period. Number 1. Number 2, irritable bowel syndrome. At any point in your life, if you've had irritable bowel syndrome, meaning like you've had symptoms of gas, bloating, diarrhea, constipation, alternating, right? If you've had any of that at any point in your life, even as a young child, your chance of having worsening allergic reactions over a lifetime goes up huge. Number 2. Number 3, any autoimmune history in your family or in yourself. Because, and we'll go into why that's the case, okay? But if you have any autoimmune history in your family, your chance, and anybody in your family, even if they don't have any symptoms right now, of having histamine allergic increasing reactions over a lifetime, crazy high. And number 4, any sort of digestion history, like any poor digestion history. So every single person that's had a history of heartburn, okay, I'm going to tell you the chance that you're going to develop worsening allergies is going to go skyrocket. And there are actual scientific medical principles and reasons why I just said all 4 of those things. Everybody who's listening, I would suppose you're drawn to this topic because you already think or you're interested in allergic reaction, histamines, or mast cell. Write those 4 reasons down. And in the comment section, even comment if 1, 2, 3, or all 4 of those things run in you or your family. And you're going to be like, ding, 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 winner, chicken dinner. And these signs are completely missed by both regular doctors as well as functional medicine doctors.
Yeah, 100%. So I'd like to look at that a little bit more actually with you. But just before we look at that a little bit more, we've talked a little bit about histamine intolerance and MCAS. Just explain for the people listening, because like you said, there's probably a lot of people listening to this that maybe think this might be a thing, but they don't know that much about it. So what's the difference when we're talking histamine intolerance to the difference when we're talking MCAS?
So the interesting thing is people with MCAS, Mast Cell Activation Syndrome, there are triggers, right? Something is triggering it. And what are mast cells? Mast cells are part of your white blood cells, some of your immunity cells. And mast cells specifically are there to react to allergens, and mast cells release. They get the trigger, and in the cells, they actually release tons of histamines. Okay, so and histamines have a variety of actions, but the mast cells will release the histamines as a reaction to a trigger. People with histamine intolerance may not even have elevated amounts of histamine, but their body reacts really strongly to it. So both of them can look very similar, but one is because there's some trigger and there's a hyper response to it, triggering a flood of histamines. So they're typically with mast cell, there is more elevated histamines. People with histamine intolerance, they actually may just react poorly to the histamines that are there. So it's almost like hypersensitivity to it, but they look exactly clinically the same. And the underlying causes are actually very similar. So that's why they're talked about together, because they look clinically the same. And the underneath triggers that I just talked about, the 4 hidden triggers, early precursors, are similar, if not exactly the same.
Yeah. So let's look at those triggers a little bit more that you mentioned. I'd particularly like to jump into the autoimmune one, because a lot of people listening to this, autoimmune is what I do. So a lot of the people listening to this are going to have autoimmune conditions, and PCOS as well. That's one that I know a lot of listeners have, that polycystic ovary. So what is the link between autoimmune and getting these, histamine intolerance or MCAS, sort of these allergic reactions?
I think the way we think about the immune system needs to get bigger and way bigger. For me, I think about at least 3 major functions of the immune system. Most people think of the immune system and says it's there to fight germs. Like, you're a germ, you're outside my body, and I'm going to kill you. I'm going to recognize you and I'm going to kill you. As soon as you invade my body, I'm going to be protective, right, against foreign invaders. One role. A second role would be to allergic. The immune system is there to say, hey, you don't belong in my body. You look kind of irritating. And I'm going to start sending an allergic branch of my immune cells to you to kind of deal with you, encircle you, increase some fire alarms around so the body can do something. So the second branch is going to be allergic. And then there's a third branch, which, hey, I'm here to survey the body. And if there are cells that look foreign to me, like cancer cells, I'm going to encircle it. I'm going to try to deal with it. So there's multiple branches of the immune system. And autoimmunity is an interesting, complex group of diseases where certain branches of your immune system looks at your body parts, your normal body parts, and says, you're German, I'm going to kill you. And it could be any body part, right? So for example, like, let's say you have Hashimoto's. Your body looks at your thyroid and says, you're a germ and I'm going to kill you. In rheumatoid arthritis, it could be certain parts of your joint and says, you're a germ and I'm going to kill you. So you have the names of all these autoimmune diseases, which are just naming the targets, right? But here's the problem. The target isn't really the problem. The problem is an immune system that's making mistakes and misidentifying your own body parts as a germ. This is a problem. It's a mistake that it's making. And so with any autoimmune disease, your immune system is used to making mistakes.
This is what we talk about when we're talking about molecular mimicry.
Right? So here's the problem. If your body is already being irritated and hyper-triggered to attack your own body, what do you think is the likelihoods is going to be also looking at other, let's say the allergy branch, and start to say, I'm going to overreact to this. I'm going to overreact to that. I'm going to overreact to that. I'm going to overreact to that. It's just an immune system that is out of balance. And can't that happen to another branch, like the allergy branch?
Yeah. I always describe it to patients as it's a loss of tolerance. That's effectively what it is. If you've got loss of tolerance in one part, why wouldn't you get it in another part? Or if there's less resiliency in one part, why wouldn't you get it in another part? It's all the immune function. It's all the immune system. And that's why that diagnosis is good to know, but isn't the sort of the be all and end all.
Well, I think it's really critical for people to really understand how many of the chronic diseases we have today are actually autoimmune.
Yes.
And when they start to understand, the doctors don't, but when they do, like diabetes is autoimmune.
Yeah.
Right? Like polycystic ovarian syndrome, which is a really common hormonal imbalance, is highly rooted in autoimmune. It's a huge marker for people with autoimmune disease. Even people walking around with heartburn, a lot of them are dealing with autoimmune problems. And how common is heartburn? So I would say most of the chronic diseases that we have, whether they're named or unnamed, has its root in something is wrong with the immune system and it's attacking your own body. Or now, conversely, it's also hyperreacting to allergens.
Yeah.
More and more and more. Even heartburn could be related to a heightened allergic response to food, supplements, medication, whatever, right? There's a lot to this, but I think that this hyperreactivity of the immune system, right? So all these branches are connected. They're all working together. And if you're overreacting in one area, you're going to be doing it in other areas as well. Boom. That's how mast cell histamine is connected to autoimmunity.
Actually, we'll link below the episode because there is a website you can go to look at a list of autoimmune diseases that have been classified now as autoimmune. And I think there's now over 100 on there. But we'll put the link to that below the episode because people just don't realize that they've got autoimmunity. I've got on my intake form, I've got what diagnoses do you have? And I also have a box to tick if you have autoimmunity. And I can't tell you how many people write down an autoimmune disease and then tick no to they don't have autoimmunity. Because people just don't realize and people are not told that these conditions are autoimmune. So I'll put the link below. And then if you can go down to the link, you can have a look. But what you have to remember even with that is just the conditions that have been confirmed as autoimmune. And actually, there are so many more.
Thousands.
Yeah, that are very, very highly likely autoimmune as well.
Thousands. And I even think about thyroid, hypothyroidism, low thyroid. Many listeners out there, number one, they don't even know they have low thyroid because they're getting not enough testing and not enough doctors trained in functional labs, right? And not enough doctors really care whether your hypothyroid, low thyroid is autoimmune or not. But did you know, and I'll ask the listeners this question, if you take all comers with hypothyroid, low thyroid, what percentage of them are actually autoimmune related? Based on studies, like 60 to 80%. How many of them even know that their hypothyroidism is autoimmune? Probably less than 10%. Yeah. It's really, really low. So really, some of the most common conditions that we have on the planet, people don't even realize is autoimmune because doctors don't really care whether it's autoimmune or not. You know, all we care is what medication dose or adjustment we have for people with low thyroid. We don't care if it's an autoimmune attack. Well, I care because this person I just told you, is 10 times higher risk of cancer. This person I just told you is higher risk of also developing mast cell or histamine intolerance or other autoimmune diseases later in life. So why aren't we on the front end recognizing this and preventing or early treating those other consequences of having an autoimmune issue?
Yeah, I put a post out on social media actually, not that long ago actually, it's like probably a couple of months ago now, saying that if you've got one autoimmune disease, then you're at higher risk of developing more. We tend to collect autoimmune diagnoses. And I got one person put a comment up and it was, oh, you know, you're scaremongering and, you know, and this and that. And it's just, you know, and all of this. And well, that was my response as well. But I just sent back, I was like, this isn't about scaring people. It isn't about sort of saying to people, oh, this is what, you've had it. This is what's going to happen to you. It's about educating people so they know that that's a risk factor for them. And this, by the way, tons of studies on this being an issue where you collect these conditions once you've got one. And it makes sense because if they are aware of it, exactly as you've just said, they can look for those 4 big signs that it might be an issue for them in the future. And then they can do things about it. It's about being preventative. It's not about scaring people.
This is what happened to smoking in the 80s and 90s. When people started pointing out that smoking was linked to cancer, people were like, oh, you're just like left-wing fear-mongering. And there were thousands of studies that said this. It's facts, it's science. And if that stops even one person from smoking and getting that cancer, then great, I did my job.
Yeah.
And I look at right now with mast cell, bringing it back to mast cell and histamine, what is the smoking gun? Is there a smoking gun that is something that can be done that intervenes in someone who already has those symptoms or who's afraid of getting those symptoms or has family members who has it and they're looking at everybody else? And yes, there is a smoking gun. I would love if you think there's a smoking gun, what you think it is, because you've seen it in a lot of these patients. And for me, like I alluded to it earlier, the one smoking gun I see is digestion. People with poor digestion. And I'm going to say this and explain it in a very simple way, which is this. Digestion is there, and there's multiple steps in your body to digest. And what is digestion? It's there to take like big pieces of food or supplements or medication, big pieces of molecules, And each step breaks it down to smaller and smaller and smaller pieces. And when you get really, really small to the molecular level, the smaller those pieces are, number one, the more easily absorbed and your body can deal with it is, number one. And number two, the lower the allergens that surround that molecule, meaning the things that trigger the mast cell or the histamine intolerance, okay? So then doesn't it make total scientific sense? Think about this, that if you have a lot of allergic reactions, your digestion sucks.
Yeah.
There's some steps or multiple steps in your digestion that's broken. And the answer is yes, yes, and hell yes. So for me, the most important thing that people need to do immediately, if they have increased allergic response, and I don't even care, it's your 2-year-old with eczema on their skin. How many 2-year-olds and how many babies have cradle cap and eczema? See that as a sign that there's going to be stuff coming later. And then the most important thing as a parent, or the most important thing you can do for yourself, is say, I'm going to start working on thinking about learning more about digestion and fixing digestion so that those molecules can be smaller and smaller. So I decrease the amount of allergens that my body's being exposed to.
Yeah.
It's a smoking gun.
Yeah. And it makes sense as well when you think about it, if people think about it logically, because we always say like gut symptoms or gut issues don't necessarily result in gut symptoms all the time. They can be the bloating, the constipation, all the normal sort of signs we expect, but it can come out in things like brain fog. It can come out in things like skin. You know, those can be gut disturbances as well. And a lot of the allergy stuff comes out in skin, you know, like exactly as you've just mentioned, eczema. So it's all very linked. When you look at the immune system with the autoimmune, with the allergy, all the allergy stuff is immune related. It makes complete sense that these things are all interlinked. It's just about looking at everything as it's a whole picture, isn't it? It's taking the body as a whole.
It is. And I think about digestion, though, is that it's not the one pill answer that our medical doctors want or the pharmaceutical companies want. And it doesn't immediately, oh, you have an allergic reaction and you're breaking out or you can't breathe. It's not like one pill and immediately you're going to fix that. It's literally like people, like doctors and patients, need to understand what are the different steps in digestion, what are the signs, what can be done. And then literally meal by meal, as things get digested better and better, within a matter of a couple of weeks, we see results. And some people, their histamines or the mast cells so sensitive, it may take a couple months to see those results. And that's from digestion alone. That's just one thing that we're isolating as a smoking gun, one of the causes of it, right? But digestion is so damn important. That's why in my book, the first chapter is called Leading with Curiosity. But the second chapter is my first medical chapter, and it's called Digestion, the First Domino. And I was thinking about it, and I was like, would I want to be known as Dr. Autoimmune, Dr. Hormone Balancing, Dr. POTS, Dr. Mast Cell? And I was like, you know what? If my legacy is Dr. Digestion, I'd be pretty happy with that.
Yeah. We've talked about the fact that it's notoriously difficult to get diagnoses for these sort of things. It's not well understood. So what are there tests that you would recommend that people get done? Is there, how would you recommend they go about it if they are listening to all this and they're thinking, I've got all these risk factors that you're talking about, I've got the symptoms that you're talking about, maybe they've got autoimmune or they've got, you know, PCOS or whatever it might be. What would you say is the next steps for them? Where would you suggest they go? Because I think this becomes a big problem, is they might recognize it, even the ones that do recognize it, and a lot of them don't, but even the ones that do, the question I think that I get a lot is then, what now? Like, where do I go now? So what is there testing that you'd recommend people have? How would you suggest they go about getting that diagnosis?
That's a really good question, because when I think about digestion and food allergies, let's say digestion and its impact on food allergies, that is a huge black box out there. And regular medical doctors have said digestion doesn't matter and food doesn't matter. And you all know, every audience member knows that that's BS.
Yeah.
Then the next question is, what can I do about it? And for me, I had to create a program for that. I had to create a program. And I think about what we do in that program. It's probably akin to what some functional medicine doctors are doing with their patients. And so the two things that I think are really critical, let's say dealing with digestion, is number one is I had to create a program called My Food Mapping Masterclass. And food mapping to me is a system. There is a systematic approach to this. And for me, I created that system. And what it entails, number one, is educating people on what the different steps of digestion is. What are the signs and symptoms? There's no test that's needed. It's your education. And then also responding to, trying different ways to intervene and improve digestion. How your body actually responds, let's say, to taking bowel salts, to HCl acid. It's actually data points. So the test is actually in what if I intervene in this way, in that way? How does my body respond? And that's the data points. People can very quickly, working with good professionals like you and us, for example, figure out, oh my gosh, this is what's wrong with my digestion. Here's how I fix it. But it requires a relationship and troubleshooting with a good doctor that understands and cares about digestion to really quickly get that figured out. Number one, right? And so we do that on my food mapping masterclass. The second thing is, I think accurately using data to identify people's food sensitivities, I think is really critical. And that's one of my conundrums with functional medicine. There's a big back history here where when people talk about food allergies, they're thinking I go to the allergist and get my skin tested, IgE allergies. That's not the problem. Most people dealing with mast cell and histamine intolerance have already seen the allergist. And then that's not it. And that's not all. And that's why they come to us. And they have another branch of the allergic system. There are multiple other branches. It's not just one branch of the allergy system. Your allergist will think there's only one branch, which is called the IgE branch. We know as functional medicine doctors or scientists ourselves, there's multiple branches. So are there accurate ways to test for these other branches? And the answer is yes. But according to our allergist MD colleagues, the answer is no. And there's some truth to both sides of this, which is that there's a lot of testing for IgG, IgA, food sensitivities, we call it. They're still allergies, but we call them food sensitivities. A lot of those tests suck.
Yeah.
And because they suck, they get thrown baby out with the bathwater. And people say all testing for food sensitivities suck. That's not true. There are good tests. About 1% of tests on the market I really like. And I've done, at this point, probably 16,000 of these tests. I would say that when you find a functional medicine doc that is really experienced with digestion, troubleshooting them, working with you, number one, fix the digestion, read my book. And I'm going to give you guys a copy of my book who's listening for a download. Or if you're in the States, you could get a hard copy for free. Bonus, okay, if you got to this point of the podcast.
Amazing. We'll link that below.
Thank you. Fix that digestion, right? But number two is work with a doctor who has a strong history of using scientific-driven data to do testing to identify what are the food sensitivities that you have, okay? And that does require some work on your part because many of the tests suck. And I think in my food mapping chapter in the book, I have questions that you can ask. And then the other part of this is this, working with an experienced practitioner who understands food test sensitivity and does testing with it, I think is important because people with screwed up immune systems have a lot of what we call false positive, false negative results. So I'll hear it all the time where someone says, I brought my kid in and I got tested and the testing shows I was allergic to 96% of food on the planet.
Yeah, I see that all the time.
It's not real.
And then the problem is they start cutting out 96% of foods. And by the time they get to us, it's like, oh, I'm eating like nothing. And that's not good for digestion.
And they're worse. Even on a really good test, if you're not working with an experienced practitioner, they don't realize that those are erroneously elevated because you're in a situation where everything, like your histamines or mast cell are super high. Not understanding what could be false positive and false negatives is to your detriment. And even when you go to Institute of Functional Medicine in the US, training thousands of functional medicine docs, they're advocating for elimination diets versus testing because there's a lot of problems with bad tests. So their solution is, let's just put everybody on elimination diets. Well, here's the problem is you already have these people with mast cell who says that they're reacting to all these things. And you start putting them on these massive elimination diets where you do eliminate, 90% of food on the planet. And they're supposed to one at a time reintroduce these things. And I have people after 18 months, 2 years, 3 years of doing this are sicker. They have no new additional information. They're more lost than ever because their digestion wasn't addressed. Number one, a lot of these reactions are digestive. So it's not even allergic related. Or number two, their mast cell or histamine reactions are so influenced by even environmental and hormonal and other factors that this whole elimination process is wasted. It really doesn't provide much useful information. And long-term elimination diets makes people more sick.
Yeah. It's a bit of a similar thing. I had a patient that came to me relatively recently, and she was a doctor actually herself, but she was getting diagnosed with what she thought was collecting lots of different autoimmune diseases. And she got rheumatoid arthritis, and they were giving her just labels of giving her all this stuff. And We did some autoantibody testing. We did lots of testing on her in the end, but she wanted everything done. She definitely had that doctor's brain of, I want to see it in front of me on a piece of paper. And we definitely went down that route. But we did the autoantibody testing. And what she actually had was polyreactive autoimmunity. For people listening who don't know what that means, is she didn't really have one single autoimmune disease, and she wasn't really collecting these autoimmune diseases. She had this total loss of sort of tolerance, and she had this polyreactive autoimmunity. She was kind of just flaring up to everything. And when we ran the test, it literally it lit up like Blackpool illuminations which is a very lit up tower for those of you in America who don't know what Blackpool Tower is. But she just lit up everywhere, all over this thing. She was reacting to everything. And actually we went back to the basics of working on digestion, working on immune function. We didn't worry about the diseases, what she'd been diagnosed with.
I don't even care what the diagnoses are, what the targets are.
Yeah, we were just like, forget it all. Let's go back to the fundamentals. Let's balance the immune function. Let's balance the digestive system. Let's find any infections. We found some viral infections in her as well that were low light. I mean, she was a doctor. She worked in sort of acute care, so she was coming up against infections and stuff. But we did all of that. She went from not being able to walk down the stairs. She literally had to go sideways, holding onto the banister down to get downstairs. And this was somebody who was used to running around a hospital. She worked on a hospital ward. And she went from that to she's going on hiking holidays and she's doing everything again. And we did nothing for any of the diagnoses, nothing specific for diagnoses.
Exactly. That is beautiful. And this is what I see when people come to our food mapping program. For example, in our food mapping program, where anybody could do it globally around the world. Basically, they come in and we work with digestion, we work with food allergies directly with them, right? And we could do globally, right? I call it 6 weeks, one and done. People are like, what? It's a 6-week one and done. And I'm going to ask you, with your doctor that you worked with, and then it's probably helpful that she was a doctor who was open and curious and willing to implement. How quickly was the major turnaround that you saw?
So I worked with her for quite a long time, because what happened was the response time was actually very quick. So she started feeling better. She got a few wins sort of quite early on. And then really by month 2, 3, ending into 3, she was really seeing significant difference. We carried on working together then for quite a long time, because she was so amazed by what she had with that. She was like, well, now I want to test this, and now I want to look at this, and now let's do this. And she loved it, and it just became she wanted to know everything. So we worked on optimizing everything at that point. But the really kind of big turnarounds are pretty quick.
I know. And that I call that the gateway. It's almost what's your gateway drug, right? What I find is when you can fix digestion and food sensitivities, that becomes the gateway. They experience this dramatic response that are quick, measurable, and really impactful so quickly that it lights a fire. People are like, now I want more, right? So, and then what I find is when people come into my world, coming into, let's say, my food mapping masterclass, it's unbelievable, but they're like, I'm willing to entertain this for 6 weeks. And then they see such dramatic response. Then it's like, oh my gosh, now I want to balance my hormones. What's happening with my hormones? How are they connected? What's happening with my other vitamins and nutrients? Or is there an infection that plays a role, this and that? And here's the thing. That's the other aspect I think functional medicine has backwards. Many functional medicine docs start by looking at a patient like you just mentioned, which is the typical listener we have here with all these autoimmune reactions. And they start with, let's identify what infections are there first. And let's work on this end to eliminate infection. Now, I'm going to say something that's completely contrarian to this. We're starting with the wrong end of this problem. We're literally starting at the anus and hoping it helps, okay, when you deal with infection first. And the reason is, guess what's in front? It's your digestion.
Yeah. North to south, always north to south.
Oh my God. And here's the thing. Every single step of digestion as the food and germs move through your digestive tract is the defense. It's a layer of an army, layer of an army, layer of an army, layer of an army. When those layers of the armies start getting compromised, at the very end, the result is a war field that's damaged in your gut and in your body. And then these infectious organisms, Epstein-Barr virus, Lyme, long haul COVID, come in and they love it. They love it, right? Infections are there as an end result of all these steps in digestion not being fortified every single step in the first place. And then you have a shit show of a war zone environment, and then infection comes in. And then what happens is people will go see their functional medicine doctors and get the $1 million workup about infection. And all the focus is on, let's kill this infection. Let's get rid of this infection. But it never goes away. It keeps coming back over and over again. And the reason is that environment never changed. How can you permanently deal with infection and prevent recurrence if you're not Dr. Digestion with optimal steps of fortification every single step? You can't. Let's stop starting at the ass. The back end of this problem, right? And the truth is it matters, but it's, to me, infection is just one of the victims.
Yeah. And it is that two-pronged approach, isn't it, of potentially needing to eliminate those things that are infectious or pathogenic or unwanted in some way. But the most important thing is creating an environment that doesn't allow them to live within you. We don't want an environment that suits them. If you think about it, if you're just trying to push down all of those, any of these pathogens, whatever we're talking about, any of them, if we're just trying to push those down, but we've got an environment that is really good and they're just growing and loving it, it's how are you ever going to get that down? Because you're just you're pushing down and it's pushing up. What you need is to create an environment that it can't survive in. And then if you need to, get some of it out to eliminate.
I also think, though, this goes into the business of functional medicine. When we say follow the money, you can follow the money like in every business. And when you follow the money, you can see why people have certain conditions and certain protocols are the way that they are. There is a huge amount of money to be made on the patient with the infection that comes back and has it over and over and over again. It's really a recurring business model. And so what you find is a lot of people are like the Lyme specialists or the SIBO specialists. But what you see in their practice is that's the major niche that they have. And there's a lot of profit margin around treating and dealing with this with IVs, supplementation, and visits. And it's long-term, so recurring subscription model. And then the problem is that they never, ever clear this problem. So you have a recurring, lifetime recurring subscription model of a chronically ill patient. And so these practices are really full, really profitable, and they are doing some good, but the problem is it just keeps coming back. So it's a recurring revenue model. Well, for me, like the way you just approach this patient who's a doctor is brilliant. This is where I tell people order really matters. Doing the right thing at the wrong time is still the wrong thing. And the more functional medicine doctors that we train and that patients work with that understand this order, they're going to get patients with much more bigger, faster, more permanent results.
Yeah, because I quite often get people coming to me and they'll be like, maybe had a few appointments, working through things, had a few consults and things. And then we'll get to a point where it's like, we need to do this now. We need to try this. And they'll be like, oh, I've done that before. It doesn't work. And I'm like, well, just try it now because you did it, but you did it at the wrong time. Now that we've worked on these other things, just give it another go and see what happens. And sometimes people are quite reluctant because they're like, well, I've done that. It doesn't work. Don't want to do it, and things like that. And it's like, just try it. If it doesn't work again, what have you lost? But just try it. And more often than not, because we've dealt with whatever we needed to deal with first, they come back and they're like, actually, do you know what? It's worked. And it's not actually that necessarily that people are doing the wrong thing. They just are not dealing with other things first that need dealing with first. And getting things in the right order is really important.
So I train doctors. I certify doctors to be able to teach the information that we're talking about here today. One of the things that I find that's missing in functional medicine doctors is a high level of certainty and confidence. And I think because many functional medicine doctors are dabblers, meaning that they get niched very quickly into one thing because it's easier. We see this in medicine where to be a family medicine doc or a general internal medicine doc, it's harder than going to be a liver specialist, let's say. It's so much easier to have one area of knowledge super deep, 1 mile down. And I've said this a million times. I think that family medicine doctors and general internal medicine doctors are way more positioned to be the best functional medicine doctors. And the reason is because we know a lot about a lot of things. And so what happens is you have a lot of people going into functional medicine. Let's say it's an acupuncturist. Let's say it's a chiropractor. When they go into functional medicine, they're like, I don't know about kids. I don't know about hormones, and I don't want to. It's too much. And so they niche really quickly. I am going to be a pulmonary functional medicine doctor deals with mold. Really quickly, they get into a very narrow spectrum. And so what I find is that when you are looking at what I call general functional medicine, which is what we're talking about, there is a dire lack of doctors who are actually qualified and trained to act in that space as the general functional medicine doctor. That's a jack of trades of these major fundamental things. So if you're not a jack of all these things, how do you know, or why do you even care that there's an order to this? I don't deal with hormones, so that can't be part of your order then, right? Or I don't know jack about digestion, or do I care? I deal with mold. Well, you better understand digestion if you're dealing with mold.
Yeah.
But they don't. I'm not a GI doc. I don't need to learn digestion. I don't need the mold. I just need all my protocols and IVs and stuff to deal with, this or that. And it's not true. So we're lacking really amounts of functional medicine doctors that have the medical background and then also the functional medicine skills to deal with the fundamentals in the right order. And that we are not training those doctors to really present what it is that we're doing with high level of confidence and certainty. So then there's not enough doctors that are confidently coming out and making a stand and presenting this as a system that needs to happen.
Yeah. And it is, as we said, it is really difficult getting that diagnosis. But if hopefully people listening to this now are taking notes and they're writing these things down and looking for things and knowing what to do. So let's have a little look at if people are recognizing these symptoms. Let's sort of start with dietary, for example. What role does diet play in MCAS and histamine intolerance? I know we talked about the digestion specifically, but in terms of actually how we heal from it, how does diet come into play?
And I'm going to limit to one thing because it's the most important thing. The one thing that's the most important thing in mast cell and histamine intolerance is to get off gluten. And the reason is that gluten is a trigger of autoimmune disease.
Yeah.
Gluten is a trigger. It's the biggest irritant of every branch of the immune system. There are scientific reasons, and there's the way the molecule looks. No matter which branch of the immune system you have a problem with, gluten is irritating it. So it doesn't matter if it's allergic or non-allergic. It doesn't matter if it's autoimmune disease. It doesn't matter if it's cancer. It doesn't matter. Gluten is a trigger of it. So for me, like getting every single person on a gluten-free diet for at least 3 months, I think is really critical because we need to clear that allergen load and that irritation load lower. And then everything else can layer on top of it. But to me, that's non-negotiable first and only thing because it's the most important thing because it is a known irritant of every branch of the immune system.
Yeah. I was talking to a friend of mine who actually specializes in working with cancer patients. And she's just been on the podcast. We were talking and we were saying how a lot of the dietary things that you would do for cancer, there's actually a lot of crossover with dietary things that you would do for autoimmune. Because we're looking at that immune, that's what we're looking at. We're looking at immune function with both of these things. And it's the same with MCAS, histamine, POTS, as we talked about with you last time. It's the same. We're looking at that immune function, right?
Mm-hmm. And what they actually are finding in cancer treatment is that certain parts of the branch of the immune system that's supposed to detect and kill cancer cells, either genetically or the gene get broken. So it doesn't protect and survey and fight against that particular type of cancer cell. So literally, it is a broken piece of the immune system that is the cause of this cancer. So it's all back to the immune system. And so for me, like cancer is an immune disease. It's a deficiency. It's a defect in certain parts, different parts of the immune system, period. So then that's why I go back to dietary. When people say dietary, I'm going to say first thing first is get rid of the gluten, and which is what we do in the food mapping masterclass. And it doesn't have to be permanent for everybody. And the best way to know whether you have a sensitivity to gluten is to be completely off it for 3 months.
Yeah.
That is the gold standard. And then you can try to reintroduce it. Certain people should never reintroduce it. And some people will get data to show that they should never reintroduce it. And some people will be able to reintroduce it. And when they introduce it, they can tell what is the data my body is giving me to show me that, oh, wow, it is a real thing. So it's part of the data collection process. I'm not uniformly telling everyone on the planet to be gluten-free.
Yeah.
I am telling every single person who's dealing with a chronic disease or symptom of some type that they're struggling with to absolutely do that for 3 months and work with a really high quality functional medicine doc like Nicole, like ourselves, like us, on digestion and food sensitivity.
Yeah, that's the advice I always give people with gluten as well. Exactly the same. I think working with a lot of autoimmune clients, I talk a lot about gluten and eliminating gluten, and people often send me questions on like Instagram and things like this. We'll often reach out and sort of say, should everybody be off gluten? I'm not demonizing gluten. I'm not saying everybody should be gluten-free. A lot of the time I'm talking about that because I work a lot with immune health conditions. it is different for everybody. But I do get asked that a lot because a lot of people sort of think I'm anti-gluten, and I'm not necessarily anti-gluten. I'm anti it for the people that really need to come off it, whether it's short-term or long-term.
I am a fan of the curse words. I'm just going to say I'm anti a effed up immune system. I take great pains in our programs to do diagnostics, education, testing, reviews, masterminding, data review, symptom review, to educate people on exactly who should and who shouldn't consume it.
In your opinion, can people take a totally natural approach to dealing with MCAS and histamine intolerance?
Yeah, I think 90% of individuals with MCAS and histamine intolerance never need a single medication.
Yeah.
And that's my experience. That is not the experience out there, because their only treatment out there is maybe like your allergy medications, ketotifen, steroids, those kinds of things. And I would say that even if someone comes to me on those medications, 90% of them are going to be off when they're done working with me. And there are some people where it's so reactive, so far out, so life-threatening that they need to be on some amount of medication. And that's fine. I'm not anti-medication. Why aren't we identifying the people, the 90% of people that don't need it and can completely recover from this? And then identifying the 10% of people who should stay on medication, but maybe on lower doses or occasional. That's what I love doing. And that is exactly what I see as solutions and the journey that people have with mast cell and histamine intolerance, working with someone like you and working with someone like me.
Outside of diet, we've talked a lot about food. We've talked a lot about digestion and things like that. What about the lifestyle and environmental factors? What are the things that you see coming through that act as triggers? You know, MCAS does tend to follow this pattern of flare-ups that we see with autoimmunity as well. You can see sort of flare-ups of it in people. Outside of the dietary, digestion, that sort of thing that we've talked about, what are those sort of lifestyle, environmental factors that you see in people that maybe trigger flare-ups or are just there as a root cause of why they've got it?
So the thing is, to me, that it gets into a lot of red herring territory, because what I see is this: it's actually a totally different thing that comes up when you say lifestyle and environmental. I'm going to focus on lifestyle and one area of it, and that's hormonal health. Well, specifically, certain times, or when a man, a child, or a woman's life, when their hormones are out of balance, is when we see these flares or the diagnosis of it. So your hormones is totally linked to your immune system, whereas digestion is the smoking gun, right? What is the hidden, almost the secret underneath my mast cell and histamine is we got to test, we got to balance, we got to fix people's hormone balance so that their hormones are going like ooh, all over the map. And that's the trigger. That is the trigger for a lot of people. Like, how many of those patients coming in? You said by your guesstimation, 40% of people coming in have some symptoms of mast cell and histamine. How many of them are women between the age of 40 and 55?
The vast majority.
Why?
I got asked the other day, because I've been talking about my book, which is coming out in November, and ooh. I had people ask, exciting. I've seen the first pages of it actually looking like a book, which is really exciting. But yeah, they asked me the question. They said, if you work with, you obviously work with autoimmune and immune health people, why have you not just written a book on the immune system? And that was their question. I put the contents, the table of contents sort of thing went up as a little sort of preview in the book. And this was the response to the story was, why have you not written the book on the immune system? And I was like, I have written the book on the immune system. There's 8 pillars. There's 8 chapters of one of each of my pillars in there. There is immune. That is definitely in there. There's gut. There's hormone. There's adrenal. There's brain. These things are all in there because they're all interlinked to this. All these things in there, they're all interlinked to the immune. You can't just look at the immune system. The tagline for the book is supercharge your energy, strengthen your immunity. And it's all around energy and immune function. It isn't just for people with autoimmune disease. It isn't just for people who want to optimize their health. It's for all of these people, because you can't have balanced immune function and not look at all these other areas.
So what you did and what I did, like, it's funny because my book is 8 out of the box ways to transform your health, right? So you talk about your 8 pillars and I have my 8. And I love the number 8 because it's an infinity sign.
Oh, that's the symbol we've used in the book.
Really?
Yeah.
It's like you're my sister from another mother. I love this. And so for me, like, that's the piece is it's like a playbook for like whole body confidence or whole body wellness, right? And that's what it is it's like we talked about all these pieces and all the order. We talk about, is your background family medicine or internal medicine? What's your background?
No, so my background is, so I originally did neuroscience and went into nutrition.
Nutrition to me is a great generalist topic, right? Where that positions you well to develop 8 pillars. When is your book coming out?
It's out on the 19th of November.
19th of November, everybody, listen up, pay attention. Because like that order matters. It's going to be there. I could already hear it when you talked about the 8 things. For me, that's why my book is 8 out of the box ways. There is, to me, around 8 major topics, major pillars, and there's an order to it.
It's funny, isn't it? The crossovers. It was that person asking me that question. And I don't think I'd even really massively overthought about it when I wrote the book. The idea for the book for me was, it was always around the 8 pillars, because that's what I do in clinic. So that was always what the book was going to be around. And I hadn't really thought about it in the way of, why are you not writing an autoimmune book on the immune system, until somebody asked me the question. It had never occurred to me to write the book that way, because it's not what we do in clinic, right? So it had never crossed my mind to write a book solely on immune function.
This is what I found limiting, because when I first started my online programs, I was Dr. Autoimmune, because my programs were about turning around autoimmune disease naturally. But the thing was, everything that I did, let's say that going through these 8 things, right, worked for every single thing. But it was so limiting, because patients started to perceive it as, well, it's my thing, autoimmune, and if it's not, you can't help me. So then you have people with POTS, you have people with mast cell, or you even have people with low thyroid. They don't even know they have autoimmune. And they're like, well, she can't work with me. She can't help me because she's autoimmune. And that's why for me, like, I had to really go away from it intentionally, because everything that we do works for every single chronic disease. These 8 pillars, these 8 root causes that you and I figured out independently, and we're writing our books about, works for every single disease. And I don't even care what your diagnosis is. Most chronic disease we have today is rooted in some part of your immune system having a problem.
Yeah.
It's really an immunity basis for every chronic disease that we see.
Yeah, I did the same thing actually, because I started out very much as like talking about it as, autoimmune clinic and that sort of thing. And I don't so much anymore, actually. I talk more about it being a chronic illness. That's what I work with, is chronic illness. I also now talk about working with optimal health. I talk about the connection between stress, the lives that we live stress leading to burnout, leading to imbalances that lead to these chronic illnesses. And I work a lot with people with the, wanting to optimize that health to keep out of reaching these chronic illnesses and things like that.
The labels become really limiting.
Yeah, exactly.
None of my stuff says anything about really just autoimmunity, except some of my really older marketing materials. And it's interesting now, people with autoimmune don't seek me out as much now. And I'm like, where are you? What happened? Now people come see me for hormone imbalances. They see me for food sensitivities or digestion problems. They see me for mast cell. They see me for POTS. And I'm like, what happened to all the people with autoimmune? They're still looking for that super special rare doctor that's the expert in autoimmunity, not realizing that I'm still right here and you're right here. But it's like they need that label. There's a pathological need for a label of autoimmunity for people to feel like, because I think there's an underlying belief with people with autoimmune disease that I'm a super special rare zebra. And I need the super special rare unicorn doctor to understand the super special rare zebra. Now then I can deal with it. And the whole naming and labeling of this is disastrous.
Yeah. And they're not rare. They're not rare cases. In fact, they're probably some of the most common cases.
Like that doctor you're talking about with the polyautoimmune, right? Like, this is my everyday patient.
Yeah.
But I think part of having autoimmune disease is that people get isolated and people have so many doors slammed against them. And the experience by the general doctors, even rheumatologists and GI docs dealing with their patient, is they think that they are a super special, rare, untreatable case. So I don't blame them. It's a system that reinforces that, and it becomes the obstacle for them, unfortunately.
Yeah, absolutely. So for people, if they're listening to this and they're thinking, the alarm bells are ringing now, they're thinking, hold on, maybe this MCAS, this histamine intolerance person, this might be me. And they've not got a diagnosis at this point. Let's just say they are just listening to this and sort of thinking, this is me. What would you tell them to do? What would be the next steps you would say to them now, go and do to start healing, to start getting your answers? Stop.
Yeah. So education, I'm always going to tell you education is going to be the first step, right? So how are the ways you can educate yourself? Number one, there's going to be a link to get my book. You could download it or you could get the copy depending on whether you're in the States or out of the States, right? Number one. Number two, I actually created a Mast Cell Activation training series that's free. So this kind of conversation, they need to hear this. Their doctors aren't hearing it and they need to hear this. I think it might be even up to 8 parts right now, but it was started out as the 4-part, 5-part, 6-part, 8-part. So there's going to be a link we'll share with you where people could just go there and get it entered, and it will give you I don't want to limit myself and say it's 8 parts. By the time they get it, it might be 12 parts, but get the training series on mast cell histamine intolerances to educate yourself. So I'll give you the link for that. And then it's delivered to email and all that. So then you're going to be fed day by day on educating. And at the end of that period of time, and it may just be a week, you're going to find yourself to be the smartest person in the room, and you will know more about mast cell and histamine intolerance than any of your doctors do. That's where you want to be at. And that's going to arm you. So then the next step after that is finding the right practitioners to work with. Because stop wasting time with bozos. Like when you heard what we just talked about here, I would say there's less than 1% of functional medicine doctors on the planet that is doing what we're talking about in the order that we're talking about. But you wouldn't have that discernment to know and the right questions to know unless you're educated yourself.
Yeah.
Because you're going to go to one and they're going to be like, oh, it's all the mold. Let's start with the mold. And I'm going to say, you're going to remember Dr. Maggie saying, don't start with the ass. Don't start with the back end, the anus of the problem, right? Really start at the front. So you want to be interviewing doctors and have them say, what's going on with your digestion? What's going on with your food sensitivity and allergies? Like what's going on with nutrition, diet, lifestyle? What's happening with your hormones? You want them to be asking those questions. That's going to be the right practitioner to work with. But you wouldn't know to ask those questions until you educate yourself. So I'm going to say, last step is this podcast. You're listening to this. Look through Nicole's podcast library and other podcasts to educate yourself even more, and comment in the comment section, letting Nicole know that, what you enjoyed about it, what you learned from, what you want more of, so that we can pump out more and more and more content to help out. So give us the feedback, give us the kudos, share it with people, subscribe to the podcast, the channels, so that you are actually rewarding the practitioners that's providing this education for you.
Yeah.
That's what you need to do.
Yeah, 100%. Totally agree. Maggie, it's been great chatting with you today, and we will get all those links off you. We will get them below this episode. We'll link some of the other podcast episodes as well, and we'll link the one we did with you previously on the autoimmune and POTS as well, because it follows on really nicely the sort of the 2 episodes. We'll get all of that linked below the episode so everybody can find it easily, your book as well, and that course, that sort of series, which won't hold you to how many parts are going to be in that by the time this goes out, but we'll link to at least 8 parts of that, and we'll get it linked below. Yeah, and exactly as you said, it really helps if people are reaching out, sending us comments, letting us know what's worked for them. It means that we can put our efforts, both you and I, into producing content that people want, that people need, and that's what's important. We don't do this. I mean, we do it for the fun of it. I do love doing the podcast and having these conversations. It's great fun, but we do it to educate people. And I always say to you, like the bast thing that a patient can do, particularly with these sort of more complex chronic sort of things, is be their own advocate and to learn how to understand the condition that they've got, be able to talk to doctors on a level with them. And that doesn't mean that you need to go off to medical school, but just on a level with them where you understand the conditions, you understand what's going on, you can ask the right questions, that sort of thing. And that patient advocacy is really important.
Well, I am going to have one action item that I think would be really something to think about. As they're listening to this, I think the biggest question people always think is, how am I ever going to find a doctor like this? And that can be daunting. Let's make it simple. If you're in England, reach out to Nicole. If you are wanting to, and for us, My Food Mapping Masterclass, that's the website, My Food Mapping Masterclass. And that is available around the world. If you want to get your digestion and food sensitivity licked, sign up for that program. You're going to be working with me and our team.
Yeah.
And you're going to get testing delivered to you around the world. And you're going to get this one and done in 6 weeks. That to me is the most important first step for anybody dealing with mast cell and histamine intolerance.
Yeah, we'll link that as well below the episode and make sure everything is down there, and how to contact both of us. Make sure that's all below the episode. Brilliant. Thanks so much, Maggie. It's been great having you on the podcast again, and I'm sure we'll do this again at some point. Thanks for giving up your time today and joining me.
I love it. Thank you.
I hope you enjoyed today's episode of the Good Health Podcast. Do share the episode with anyone you think it may benefit, and help us to spread the word on all things health and wellness by rating, liking, or subscribing to the podcast. If you want more, you can listen to more episodes on your favourite podcast app, or sign up to my newsletter for my favourite tips, tricks, health advice, brands, recipes, and more at nicolegoodhealth.com/newsletter. Have a lovely week. Don't forget to hit subscribe, and I'll see you on the next episode of the Good Health Podcast.